I've had tremors for a long time. I can't tell you when they started or anything. As I got older, it would get worse. Harder to do things. And like sign your name, put little things together. You get told there's no cure. They treat you with anti-seizure medication, and with me, they never work.
The procedure itself is done in multiple steps during the single sitting for us to first locate where the target is. We use MRI scans to define where we believe the target is in the thalamus. We then treat that area with very low dose ultrasonic energy. It's not enough energy to damage permanently the area of the brain that we're interested in, but it's enough to cause it to not function for a very short period of time. So we're able to sort of stun it for a short period of time and examine the patient and see what their response is. If their tremor's not gone or doesn't respond satisfactorily, again, we're able to adjust by 1 millimeter or 2 where we're aiming. And only once we find the spot where a small amount of energy eliminates the tremor temporarily do we then treat them with a permanent higher amount of energy to heat the selection of neurons up so that they're no longer functional. Once you're in the room, it takes between an hour and an hour and a half to complete. Most of that time is spent doing calculations and locating the area that we're going to treat, the actual treatments themselves. So for example, the final treatment where we turn that nucleus off, the collection of neurons off, only takes about 20 seconds.
Oh, the procedure was very smooth. Everything was explained to me very clearly and very precise on what was going to happen. The timing was great. You know, the staff was wonderful.
For me, the most rewarding thing is having patients come in who have really lost the ability to use one or both their arms to do any type of activities, either hobbies or work, or activities of daily living, brushing their teeth, drinking, eating, using a fork, using a knife, and seeing them immediately after the procedure, an hour and a half later or an hour later, being able to do whatever they want with that hand and being able to leave the hospital and go out for lunch without any difficulty.